Hi, my name is Åsta and I will tell you about FRAM, Falcons from Norway's research and policy paper in the E-mpACT project. So, before this project, we didn't really think that the pandemic had affected us a lot. This is because the total number of members hadn't really changed during the pandemic. However, the research did actually suggest that there was an impact on participation. We have three main findings from the research that affected the policy paper. The first one is the decline in participation among young people and how this suggests that more young people are without a community outside of school and their families. The second one is that we have fewer volunteers and active contributors to our organization, making it harder to make these arenas where young people actually can meet and create these communities. Number three, the use of digital tools and online presence is back to pre-pandemic levels. So we have also made some suggestions based on these issues in the policy paper. And the first suggestion is that we need to keep these digital skills that we made during the pandemic alive to be better equipped if a similar crisis comes about and we need to have digital activities again. And for this we need funding to be able to keep these skills sharpened. Number two, we also think that there needs to be a focus on rebuilding after the pandemic. There was a lot of buzz about this pretty soon after the pandemic, but now, a couple of years later, we still need the funding and we still need to make sure that organizations and youth work and voluntary work rebuilds, because there is still not on the same level of participation than before. So this is what I was going to tell you, and now it's over to Woodcraft Folk.
Hi, we're from Woodcraft Folk. We chose our questions for our research based on working with stakeholders and young people to find different themes of what they wanted to explore. It was clear from our initial sessions that the negative impacts of lockdown were of more interest to those who attended the sessions than the positive impacts of lockdown. We wanted to explore how young people felt during lockdown and what they thought might happen in the future when we were living in unsure times. The impacts of lockdown are clear for adults to see when working with young people, but we were interested to find out if young people could see the impacts on their peers, friends, and family members. We broke our research into two sections, one for young people to find out what their thoughts were, and one for adults, such as group leaders, staff at Woodcraft Folk, and the volunteers that we work with. What is back to normal is a question that we've been asking, taking time to readjust and realizing that we're still not back to normal. Our research showed that even in the summer of 2023, where activities had returned to pretty much normal, we were still seeing the emerging picture of the impact of lockdown on young people. This was especially in the transition between childhood and adulthood. We've noticed a real decline in those who continue to volunteer with our organisation after becoming too old to participate as a beneficiary. We're questioning whether this is due to immaturity, missed milestones and learning, or due to less build-up of resilience. It's extremely evident from our research and general Woodcraft Folk activities that there needs to be more done to address and support the young people's mental health crisis in the UK. It's worth noting that it was hard for some younger people to remember what they thought the future would be like during the lockdowns, but many people shared that Woodcraft Folk and other youth work efforts were appreciated but did not solve problems of anxiety or loneliness. At Woodcraft Folk, we are looking at different ways to engage more young people in our activities, including in the past 2 years arranging camping events for non-Woodcraft Folk members to show we're aware and wanting to help make up for those missed experiences and milestones. We're encouraging our young members to support each other and to flag to adults or to others when they think their friends are struggling with their mental health, and hope to promote peer support where possible, especially at our big camps and events. Based on our research outcomes, we propose the following policy recommendations: mental health support, increasing support for young people and their mental health; digital inclusion, so expanding digital youth work and providing more digital resources, sessions and online workshops for our volunteer leaders; training for our volunteers to enhance their programme for young people and equip them better to support young people's mental health and engagement; and creating an online community. So developing online platforms such as Discord for leaders to share experiences, challenges, and solutions. And we're passing over to Dewey to hear about their research.
Hello everyone, my name is Harun Muhadovic and I am the chair of the International Board of the E-mpACT Denmark. I want to put forward our recommendations for decision makers based on our research that we had on the impact of COVID and how the youth was impacted and how we got through that as young people and what issues we have been met with. So our research was conducted by making these qualitative group interviews online, and we had a physical session too with youngsters. And online was mostly youngsters from our youth board and the international network, while the physical one was at a board meeting, so there was a mix of ages. The main challenge we found out through our studies is that students and educators were unprepared for the transition of remote learning, leading to a disruption in school acquisition and in educational outcomes. Those living in accommodations without necessary tools faced additional hardships, affecting not only practical skill development, but also a growth of essential soft skills like teamwork and communication. So the first recommendation we have is that we need to invest in virtual labs and simulations through public-private partnerships. This will enable, of course, the practical skills learning online. The second one is that we need hybrid learning spaces. So we need to create these hybrid learning spaces in vocational training institutions and higher education institutions that combine online instruction with periodic hands-on training or hands-on sessions. And then we have the third one, which is a resource kit for students, and we need to provide these resource kits to students for home use to facilitate practical learning in subjects like craftsmanship and design. And the rationale behind this is that practical subjects faced unique challenges during the pandemic and that innovative approaches can help maintain the quality of practical education in an online format. Dewi Laya pass it to Patsimedero Trust.
Guys, my name is Panasho Makonese and my favorite animal is an elephant. Hi guys, my name is Muta and my favorite animal is dog.
Hey guys, my name is Gladys and my favorite animal is a cat.
Meow. Hello guys, I'm Henry and my favorite animal is a lion. Thank you so much. Welcome to our special presentation on the impact of COVID-19 on mental health in Zimbabwe. We're excited to share some important findings from our research.
That's right. So, our study looked at how the pandemic affected people's mental health, especially those who are in communities who are already facing tough challenges. So, let's break it down.
First up, we found that many people experienced fear and anxiety. The constant news about COVID-19 made everyone feel more scared and worried.
Exactly. And it didn't affect only adults. Even young people, young girls reported feeling very sad and hopeless.
We also talked about loneliness. With all the lockdowns in place, many people missed out on their friends and families. Many felt isolated, which can lead to serious mental health issues.
And let's not forget about the financial pressures. Many people lost their jobs, which made it hard for many families to cope.
So, what can we do about it? We can recommend improving mental health services. We can improve mental health services through using online therapy in form of recorded skits and expanding support in schools.
Our research also highlighted a troubling rise in suicidal thoughts and substance use. Sadly, drug overdoses and suicidal rates went up during the pandemic.
And it's important to promote community connections by creating community centers for recreational purposes and counseling for people to improve their well-being. Let us bring people together safely. If it means digitally, so let it be.
Together, let's help our communities heal and grow stronger.
Let's all take action for a better mental health.
Thank you for joining us today. Let's work together in order to support each other during these tough times. Stay safe and take care of your mental health. See you next time.
Now we pass it to the Slovenian Falcon Youth Union.
I fumbled the ball, just like our institutions did. Hi, we're the Slovenian Youth Falcon, and our research was based on the level of trust young people had in institutions. What we discovered was that before the pandemic, people actually trusted institutions. They were happy with the work they were doing. During the pandemic, the levels plummeted. There was no trust, there was no policies that made young people happy. And now it's gotten a bit better, but the numbers will never be the same.
For the fouls our institutions committed, they deserve a red card.
Based on our research, we have these suggestions for institutions. Believe in young people, take their opinions into account. Provide more funding for training for people to have better access to digital education, and make better accessibility for digital education. This includes also the infrastructure like internet, computers, and stuff that they might need to be able to access it. And we really implore that institutions provide some kind of way of communication with young people and for decision makers to listen to their opinions.
If institutions listen to us young people, they too will be able to score a goal.
Ahora, como parte de nuestras conclusiones, debemos mencionar que en el Perú persisten los problemas del derecho a la igualdad, ya sea por motivos de género u origen. Esto hace que diversos grupos poblacionales tengan oportunidades limitadas. También encontramos que la educación sexual continúa siendo un tema tabú en el Perú, haciendo que jóvenes y niños se desinformen respecto a estos temas tan relevantes. Entonces, como gran conclusión, podemos decir que hay una gran relevancia en lograr que las entidades públicas institucionalicen las políticas públicas que permitirán luchar por la igualdad y por una adecuada educación sexual. Y ahora vamos con Independence Youth Union.
The COVID-19 pandemic drastically impacted youth organizations in Palestine, as all organizations around the world, especially youth organizations. Our research in the Independence Youth Union examined how these disruptions reshaped youth participation and engagement. Our research focused on a central question: how did the pandemic affect the activities of Palestinian youth organizations? To answer this question, members aged between 20 and 29 were surveyed to uncover their challenges to explore alternatives. 87.5% of respondents remained involved, but participation dropped. Barriers like financial struggles, health concerns, and poor digital access were common. 65% reported the pandemic limited their access to youth activities. Despite these barriers, 88% agreed on the importance of creating alternative hybrid models blending in-person and virtual activities to ensure continuous engagement. Our findings outlined in a policy paper recommend investing in digital infrastructure, supporting youth organizations financially, and adopting hybrid engagement strategies. Palestinian youth have shown resilience. With the right tools and support, we will continue to contribute and lead our community, even in the time of crisis.